We are surging the response not only of CDC, where we already have more than 130 people in the field, but also throughout the U.S. government. The President has leaned forward to make sure that we're acting very proactively there, and the Defense Department is on the ground already strengthening the response. We're working with USAID and other parts of the U.S. government, as well as with a broad global coalition to confront the epidemic there.
All right, folks, I don't even know what to say. Again, the president today, when he spoke in Illinois, again, touting the fact that we sent 3,000 troops to Africa. That doesn't do me any good here. It doesn't do anybody any good here. Joining us now is Nick Tate, Newsmax Deputy Health Editor and Newsmax TV's Meet the Doctors contributor. And by the way, be sure to catch Nick on Meet the Doctors. It airs Saturdays at 7 and 11 a.m., and, of course, it's on DirecTV Channel 349 and Dish Network 223, as well as on Newsmax.com. Hey, Nick, welcome. We've learned so much in the last few hours about the victim of Ebola that is here in the United States in Texas. He apparently lied 3 times on his sworn statement down in Liberia at the airport, that he said he did not have any contact with anybody who had Ebola. Apparently, he took care of several victims. He was in contact with several victims of Ebola. We learned that although his family now is quarantined in their apartment for 21 days, the sheets remain on the bed, the towels remain in the apartment, and the CDC is nowhere to be found. They're sending a medical waste contractor to take that stuff away. And we learned that they're voluntarily quarantined and they've been uncooperative. In fact, there are reports that one of the kids at least went to school, even though they've been asked to stay in the apartment. So this whole thing is really quite a mess.
Lots of questions, obviously, about what's happening with this individual, how he has conducted himself, but larger questions about how I think health officials and health authorities are really going after this case. We've been hearing for weeks and months from the CDC and other health officials that this is controllable. We have protocols in the U.S. with hospitals here not to worry. Ebola is not going to be a big deal here. We should be worrying about other things here in this country. But I think this case points up that a single case can affect lots of folks. And in fact, what we're hearing also is that health officials in and around this hospital are testing up to 100 people, checking in with them and making sure that those folks that this guy was exposed to do not have Ebola. So this one little case may underscore some of the holes that are in the safety net that we've been hearing for weeks is just so secure. And the point I would make is, regardless of how this individual conducted himself and whether he told the truth or not, whether he was exposed to people with Ebola in West Africa and came clean on that or not, there are doctors, numerous doctors, nurses, healthcare workers at the ER in the hospital. There are state and local public health officials. There are federal health officials that should have been able to enforce the protocols here. So even if he was not honest about his own experiences, they should have been able to see things like temperature, vital signs that indicated that, in fact, he had something more than just a minor infection. They should not have given him antibiotics and sent him home for the weekend, where he then was in contact with lots of folks.
Right. Well, that's a whole that's another issue, and that, of course, is when he went to the hospital the first time. They sent him home, and now the great debate is, well, did he tell them, or did the family tell him that he had been to tell the hospital that he had been to Liberia? They say they did. Some in the hospital say he did not. And if so, why was he ever sent home with that being the case? It is a mess. Very briefly, if we can't stop hospital infections, and there are 70,000 hospital infection deaths a year, how can we expect hospitals to stop Ebola?
That's a really good question. The one point I would make is, in a hospital ER, there tends to be a great deal of chaos. So they're kind of messy operations, people coming in with a variety of conditions. But when Ebola is in the news and the alert is so high, you have to at least suspect that somebody coming in with these symptoms is a suspect.
Right.
That's what you have to do.
All right, Nick Tate, I appreciate it, Nick. We'll watch you on Meet the Doctors Saturday at 7 and 11 a.m. Right here on Newsmax TV. Always appreciate talking to you. When we come back, folks, we're going to be joined by the former director of the CIA, James Woolsey, will be with us. You're not going to want to miss that. Don't go away.